Hello, Brain Shakers. Welcome to today's episode. Now, in this particular one, I just wanted to share with you guys about another type of injectable contraceptive. I know I did look at the two commonest one, which is the DMPA or the Depo-Provera, and the norethisterone, which has an active ingredient called norethisterone enanthet. But I want to share with you another important method which you may find on the market, you may find readily available in those family planning clinic. It is called the SAYANA press. Now, the SAYANA press is somewhat similar to the Depo-Provera, and all it is that it contains as well a medroxyprogesterone acetate in it. So oftentimes it is abbreviated as MPA. In some literature you may find it written as a DMPA, but they contain the same ingredient as the one that you would find in Depo-Provera. Now, there are differences that you may notice with these two methods. With the DMPA IM, which is the Depo-Provera, and the DMPA or MPASC, which is the subcutaneous administration called the SAYANA press. This SAYANA press has a dose of about 104 milligrams, and it is only about 0.65 mil. So it comes already pre-packed. So all you have to do is follow the guidelines on how to basically administer it, and it will give you contraception for a period of about 13 weeks, and that is plus or minus 7 days. So it means that if you have the 13 weeks, you can still have an additional 7 days, and if you have another injection within that 7 days, then you would still be covered in terms of contraception. Whereas the Depo-Provera injection or the IM one will have a dose of about 150 milligrams. So that is the main difference. And with the Depo-Provera, you obviously have to withdraw before you can actually administer. With the SAYANA press, it already comes, it has its needle, it already comes, it is all prepared. It's about 0.65 mils. But there are certain things that you obviously need to do before you go ahead and get the SAYANA press. So the risk factors, the side effects, and all those things that are related to the DMPA will still very much apply to the SAYANA press. Now, before administering the SAYANA press, because it is already pre-packed, it has a white suspension within it. So all you have to do is you need to shake that nicely. And once you do that shaking, then you have to make sure that you remember to activate the needle before you obviously go and administer. So the activation of the needle will entail that you have to push the needle cap and hold on the middle aspect and not on the bulb where the medication is, because once you hold on the bulb where the medication is, then once you activate the needle, then it will start sipping off. And when you're activating the needle, you have to make sure that the needle is facing upwards, so that once it is activated, then the vacuum is what is on top of that suspension, and so there is not going to be a leakage, because if there's a leakage, then chances are that you're going to obviously administer an underdose, and the least thing that you would want is to administer an underdose, because it may not necessarily cover or provide the required contraception. So that is the SAYANA press. You need to make sure that you administer it in the subcutaneous layer, which is just the fat layer. Now, there are preferable areas where you can administer this. Obviously, if you want to self-administer, you can administer it on the thighs. You can administer it as well on the abdomen area. That is where you're going to find more fat there. So you just do a pinch and then you go ahead and administer. Now, there's obviously controversy on whether you should give it at an angle or you should go in straight. If you already pinch in enough skin and you go in straight at 90 degrees, you will still be getting into the subcutaneous layer. Why? Because it comes with a very tiny and short needle. So chances that you may get to the muscle layer are very slim. So even if you were to give it at an angle, or you give it that is a 90-degree angle, you would still get to the subcutaneous layer. So that is the SAYANA press. It has the same side effects of obviously potentially altering your bleeding patterns or your menstrual cycle. That is, for people that have a shorter cycle, you may in the first few days of using it have a bit of an outer cycle, that is, your cycle may be lengthened a little bit, but then when your body has acclimatized well to the method, then it will then go ahead and make you amenorrheic, and you can remain amenorrheic for a long period of time. Now, the same also with the Depo-Provera. The SAYANA press also has some form of effect on the bone density, and so we recommend that if you've been using it for a long period of time, that is up to about 2 years also, you're better off again reduce or move off from the SAYANA press, because of the chances of it affecting the bone density, then predisposing you obviously to issues such as osteoporosis and also fractures and things like that. So that is the SAYANA press. It is another injectable method that you're going to find on the market, readily available, and it comes in, it is already pre-packed, has a very tiny needle, and will offer you contraception for about 13 weeks. So it means that within that 13 weeks, you will need to have another injection for you to continue to have that contraception. It has a plus or minus 7 days, meaning that within that 7 days, you will need to have received your next dose. But then if you elapse that 7 days after the 13 weeks, then it means that pregnancy has to be ruled out. A pregnancy test can obviously be conducted, and then the dosage of another SAYANA press injection can be administered. It is important that when you have these medications or injectables or oral contraceptives or contraceptive methods that are being commenced, it is always advisable that they are commenced when you're actually having your menses, within the first 5 days of your menses, because then we would have ruled out the probability of pregnancy having occurred. So that is about the SAYANA press. Now, if you found this particular video and the other videos that I have done, don't hesitate, go ahead to the YouTube channel and subscribe. Follow me on all these various platforms, and I'm excited and looking forward to seeing you in the very next. So don't forget to share and like the video. Drop me comments in the comment section. From me, thank you so much for watching, and I will see you in the next one.